community wants to know that if my loved one was in an accident, that I'm going to get excellent care. And we have to be at a much higher level, I think, than a lot of places, because it's so far to get to a higher level trauma center.
That's one of the things we know that we have to do in preparation, because we are such a rural facility. We have so many hours and minutes away from tertiary centers to get them to that higher level of care.
With trauma, there could be multiple things wrong. Training is the key to staying on top of treating trauma patients.
So I'm Courtney Twilliger, and I'm from Swainsboro. I've been here all my life. My connection with the hospital, I was EMS director for 43 years, I was EMS for 45 here. I'm still employed with the hospital as emergency program manager, but my main role now is the public safety coordinator for Emanuel County. The biggest thing is to make sure that your staff is committed to learn, to improve. And then we got to have drivers like Dr. A and Damian Scott, our CEO, and Brooke Marsh, our ER manager, who's been a great driver to improve quality. Nikki Drake, our EMS director. They're all pushing the envelope, so to speak.
I want my staff to be trained at the highest point that they can be trained within their license, so that when something comes in the door, even if they've not seen it before, they can extrapolate from the education and the training that they've had to give that person the best possible outcome.
We've made our commitment to be designated as a level 4 trauma center, which means we now know what to do.
For example, if you're in an urban area and you're in a car accident or some other type of trauma and it takes 10 minutes to get to the hospital to maybe a level 1 trauma center, then that staff really only needs to be able to stabilize that person for 10 minutes. We may need to stabilize somebody for 2 hours.
If we go to a car accident and the patient, we see that the injuries, the person needs to go to a level 1, we'll go straight to Augusta, Macon, or Savannah. It's according which end of the county that we're on, because we sit kind of in the middle of 3.
So when they come here, obviously mechanism of injury is the first thing we take into consideration. What happened, where are you hurting at, what are your signs and symptoms, what is their normal baseline for them versus how they're acting now. We get our plan of care there, like, okay, where do they need to go now? Are they good? Can they stay here? Do we need to get them on down the road? After taking all of that into consideration as to what's wrong with them actually.
We can quickly give them blood that they're losing, maybe to keep that blood pressure high enough to get them to a center where we know definitively they need to go to the operating room for them to fix the problem, if at all. So we have all of that here. However, most of the other, small hospitals, rural hospitals, just like this hospital, they do not have that level 4 capability. So that's what makes Emanuel a little different.
And not only do we not know what to do, every month we sit down with a small group of people and look at everything we did for that month.
There are very few level 4 trauma centers in the state of Georgia, so I think that is something to be proud of. We're proud of that achievement. One of my nurses that are near and dear to my heart, Miss Gil Thornton, it was her baby, her pilot project, and so when they sought that out, I think it was to be able to provide that optimal level of care for trauma. And so it kind of holds us accountable for things, and it makes us strive to do better and to improve. And it's a lot of process improvements that are involved with that, a lot of quality measures and data collections and abstractions. So it's a lot of behind the scene work, but then it in turn helps us provide better care for our patients.